This has been a very important year for us. It has undoubtedly been a year of improvement. We are safer, we are kinder, and we are better together as an organisation. But we are all really clear that we've got an awful lot further to go before we're able to provide the types of mental health services that we really want to, and those that our service users and carers rightly expect. So our 5-year strategy has got 4 improvement priorities of improving health, improving care, improving culture and improving value. And each of those 4 priorities is underpinned by deliverable programmes aimed at making sure that the Trust not just makes improvement going forward, but sustains that improvement and improves the quality of our services. At the heart of what we do is making sure that our services are designed with and around the needs of our service users and carers.
Our service users and carers have told us to reduce waiting times for care and treatment and to improve access to all of our services. With our system partners, we're improving pathways of care and being more active within our wider communities. Understanding our need to improve our services, a clinical transformation program has been established with demonstrable success in cutting core waiting lists in our adult services and more recently in our children and young people and talking therapy services, while addressing there is still more to act on. Our Learning from Deaths report examined every unfortunate death from 1st of April 2019 to the 31st of October 2023. And identified priority learning actions and improvements we have made and will continue to undertake in the future. We're joining up resources across preventative and crisis pathways so people are given opportunities to access alternative support to hospital admission. Our goals include seeing a reduction in self-harm and suicide across Norfolk and Suffolk, making access to our services easier and improving transfer of care.
Our partners and regulators have told us to address concerns around our quality and safety of care and leadership at all levels, and we're acting on our must-dos from our last CQC inspection. Now, the way we're doing this is through our 11 care delivery teams, where we're asking our staff to collaborate and lead improvement across all our core services. We're also developing and delivering a new leadership structure based on place. This will help us improve the care that we deliver and specifically the quality and safety of the care that we provide to our patients. We want to make sure that we listen to the voices of service users and carers in our organisation and we act on those voices. To do that, we've developed a new Service User and Carers Council, which will improve the quality, safety and experience of our services in NSFT. We're really focused on improving the quality and safety of the care that we provide. We want people to be in the right place at the right time. So we want to reduce the waiting times for people to get into community care and our inpatient settings. Once patients find themselves in an inpatient bed, our focus should be on enhancing therapeutic interventions and reducing restrictive interventions.
Our staff have asked us to embed accountable supportive leadership to improve staff development and to enable better service user outcomes. Listening into action, a positive, outcome-focused movement of change has been embedded as our new way of working, delivering significant change with over 100 quick wins achieved since March and 27 pioneer teams actioning bigger picture missions that matter. Our new trust values were launched at our first leadership conference, created from wide-ranging feedback we have gathered and response to the needs of our workforce, our service users, and their families and carers. A new Inclusion Council has been formed to create a positive climate for improved fairness and inclusion in all areas of the Trust's work. Our goal is to be in the top 20% of all mental health trusts as a good place to work.
We've submitted a break-even revenue plan for this financial year, and we are working to be more effective and efficient as an organisation. We're committed to a low carbon standard across our estate while ensuring facilities are accessible to all of our communities. With our system partners, we're working to increase value and share information via collaborative working. We expect the remainder of this financial year to be challenging, but staff and dedicated work streams are working at pace to deliver improvements and efficiency. Together, we are using data better to inform our decision making, develop governance and ultimately improve outcomes for our service users. We look forward to seeing the new Rivers Centre in action in the next few months. Our programme to replace the electronic patient record is gathering pace. Our goals include making year-on-year progress towards the NHS net zero target by 2040.
We've talked about the detail of our improvement plan and our ambitions. What's really important is how we want to work with people. So we have a triangle as part of our priorities going forward. And there are 3 points of that triangle. We want to work in complete partnership with service users, carers and families. We want to work towards being able to be more confident and competent in co-production. We want to work hand in glove with our partners. People do not experience mental health needs in isolation from the NHS, so we need to work with our partners across the NHS, our primary care partners, our hospital partners, and then our social care partners, our voluntary sector partners, our police partners, fire services, and wider partners. Really important for us on our improvement journey that we're a really good partner. And then finally, we want our staff to be right front and centre of everything that we do. We want our staff to feel empowered, to feel supported, to be able to speak up and speak out, and to feel really well led and to feel a great part of a good team. This journey is very important to us. We've made some good progress this year. We have a lot more to do. We need to act with humility. We need to be open and transparent about both the progress that we're making, but also the challenges that we still have, and we desperately need everybody to be part of our journey. Thank you very much.